Hello, my name is Dr. Michael Hanrahan. I'm a public health doctor and I'm delighted to be partnering with Medicare to talk to you about men's health. In this video, we'll be discussing respiratory health. So the lungs are arguably the most important organ in our body. They're what allow us to extract oxygen from the air and convert it into energy. We've all experienced breathlessness from time to time, such as after extreme exercise. But prolonged periods of restlessness at rest can be extremely uncomfortable, and that's why having an oxygen monitor at home might help you identify low oxygen levels a little bit earlier, seek treatment a little bit earlier, and avoid severe respiratory distress. Some of the more common respiratory conditions include asthma, chronic obstructive pulmonary disease or COPD, bacterial or viral infections, cystic fibrosis, or lung cancer. If you have any of these conditions, being able to monitor your blood oxygen levels at home could be useful to prompt you to seek early medical attention in case you need extra oxygen. So this is a pulse oximeter. It's a really handy and easy to use device that will help you monitor your blood oxygen levels at home. To use it, all you do is turn it on and place it on your finger. And within a few seconds, it will tell you what your blood oxygen levels are, which we call SpO2, and it'll also tell you your heart rate. What's great is that you might not have any symptoms of low oxygen levels, but if you see it on the machine, then it may be an indicator that you need to go to hospital to get some extra oxygen. So for normal individuals, the oxygen saturation level should be 95% or greater. However, if you're a patient with COPD, then your blood oxygen levels might be normal between 88 and 92%. And that doesn't necessarily mean that you need to get extra oxygen because your body has likely adjusted to that level over time. However, if you don't have COPD and your oxygen saturation levels are less than 95%, that may mean you need to see a doctor and get extra oxygen. And if your oxygen levels are less than 85%, we categorize that as severe hypoxemia, and it means you should urgently go to hospital and seek medical attention. Okay, so if you want to improve your respiratory health, the big one is to not smoke. Also, you should minimize your exposure to air pollution, exercise regularly, and maintain a healthy weight, because having excess weight can put pressure on your diaphragm and make it more difficult to breathe. You should also try to avoid chest infections, and you can also improve the air quality in your home by checking for mold, carbon monoxide, and radon. During the COVID-19 pandemic, we saw the demand for pulse oximeters rise greatly. So if you have a customer who wants to learn more about their blood oxygen levels, you can show them one of these devices, how to use it, and what the different blood oxygen levels mean for them, and when to seek medical advice. That's the end of the video. Thank you very much for listening, and I hope you found it useful.